Welcome to The Hair Loss Show. Dr. Russell Knudsen and Dr. Vikram Jayaprakash discuss issues relating to hair loss and the medical and surgical treatment of hair loss in both men and women.
Hi everybody, welcome to episode 13 of The Hair Loss Show, our podcast. Today is going to be on the pros and cons of FUT surgery, which is another way of describing strip surgery. I'm Dr. Russell Knudsen.
My name is Dr. Vikram Jayaprakash. Welcome to the show.
So let's talk a little bit about strip. Historically, the first grafts that we used in male pattern balding, for example, were done with a punch technique, which started in the late 50s and went through till about the late 1980s. And then we moved to a technique of taking the hairs from the same area, but using a scalpel, cutting an ellipse of skin out and sewing it up. And that became the dominant technique from the late 1980s. Until the early 2000s, when the alternative technique, which is the FUE, which is another version of a punch technique, gained in popularity. And in our last podcast, we discussed the concept of whether one of the techniques is outdated and the other one, the modern, must be used all the time technique or not. And we came to a very strong conclusion that we believe there's a good role for both surgeries.
Absolutely.
So today we're going to do the first of a video cast about FUT, the advantages of it and the disadvantages of it. So in the last podcast we talked about the fact that in a young patient with a lot of balding and balding in the crown, what we're worried about long term is how much more balding is going to happen over the next 10, 15, 20 years. And how do we find the safest hairs on the back, the occipital donor area? How do we find the safest areas to take that are least likely to be involved in balding in the future? And if you take in a strip 100% of the hairs out of an area that's a long, long way away from the balding margin, that looks like a safe bet. So the first pro we're going to put up today, Vikram, is safer donor. So this is an advantage as far as we're concerned, particularly in our young patients. Also with modern hairstyles today, people have this desire to get back to work and not have anybody notice. It's always been a factor with our men. They don't want anybody to know they're having the surgery. I call it secret men's business. So another advantage I think for us is the ability to only trim what we take, leave all of the rest of the hair to length, which generally immediately covers up any signs of the sutures and the donor scar line that's going to develop there.
It's interesting.
So it's discreet.
It's discreet, and I sort of underestimated how important that was to people, because the number of people I've had that have come in and said, I've done my research, I really want to have FUE surgery, talk me through it, and we talk through it, and you go, well, with FUE, that's fine, with FUE, you're a candidate, that's okay, but what we need to do is we need to shave the entire back of their head, because with FUE, you need to shave the entire back of the head. And I was like, oh no, I need to have surgery, and then I've got a meeting that I need to attend to 2 days later. So I can't walk around with a shaved back of their head. And so you talk through those things, and then, because of that, this is a deal breaker for a lot of people.
That's right.
And then they will switch to strip just because they don't like the notion of having to shave the entire back of the head. And I respect that, that's fine. But that is, I think I underestimated how much of an impact that would have for a lot of people.
That's right. So the discreet is not just about no one knowing you've ever had it done, but how quickly can I return to work? Because whichever technique you use, when you make the incisions on the top of the scalp and plant the grafts, you get a small amount of scabbing and crusting, which can be variable, but it lasts about 7 to 10 days. But with the FUT, if the scar and the sutures disappear immediately under the surrounding hair, that's a big comfort to the patients.
Yeah. So what we're saying is that if with FUT, we only shave the strip we're taking away, and then we cut that out and we sew the ends together.
So long hair meets long hair.
So I say to patients, when you come in, this is the back of your head, looks like this. When you leave theatre, when you walk out of theatre, because everything's cleaned up and there's no bandage, it's a dissolvable suture. If someone's walking behind you when you're walking out of theatre, they shouldn't know that you've had anything done, because everything's closed up. You shouldn't really see anything at the back of the head.
And I think the third thing that we would talk about is the advantage
is the number of grafts, okay? Because so it comes back down to FUE. What you're doing is you're cherry picking, or you're taking the grafts, you're picking grafts from an area, and randomly scattering them over from a large area. But what you're doing, because when you take that graft out, nothing grows back in its place. It leaves a dot-like scar. So what you're doing is you're reducing the density of hair at the back of the head. With strip surgery, you're not doing that. You're removing 100% of the density from the back of the head. But why is this a problem in FUEs? Because, well, if you've got a lot of balding and you need a larger number of grafts, then the harvest has to become bigger, and the amount that you reduce the density at the back of the head also becomes higher. So the higher the harvest, if you need 3,000, 3,500, the higher the harvest, the more the risk that you have of the back of the head becoming sparse and see-through and moth-eaten. So sometimes I also recommend, if you're someone who requires a higher harvest, then I'm sort of more inclined to say maybe strip is a better option for you from that, because it doesn't have that issue. You're just taking the strip away.
This comes back to the variability between patients. So if you are a patient with finer hair on the back of your skull and a lower density of hairs on the back of the scalp, then the ability to use FUE becomes tricky, because you don't want to create a see-through look. If you've got people with coarse, dense hair on the back of the scalp, then you have to take a lot of hair out before that would become a problem. Not if you have fine hair with low density. So again, it's horses for courses, if you like. So that's a large harvest is an advantage with FUT, the strip surgery, because everybody, if you've got enough scalp flexibility, everybody can do a large harvest without having a negative impact in terms of the density of the surrounding hairs. So those are the major things that we go on as being the pros. So now we're going to talk about
the cons.
Okay, so you can start with number one, because this is the one that the patients really come to us about all the time.
It's the scar.
Linear scar. Okay, so again, like we said in a previous video cast, there is a misinformation campaign about FUE that it is scarless or minimally visible. That's potentially true that it's minimally visible. It's not true that it's scarless. So the secret of success in using FUE is how you distribute the scars so that they become less visible. We also know that for 80% of our FUT patients, our strip scars, because we do this closure where we overlap the edges, the trichophytic closure that we've talked about before, hair grows back through the scar line. And for most people, yes, they can wear a number 2 or a number 3 haircut and nobody will be any the wiser. And that's probably true in over 80% of patients, but it's not true in 100% of patients. And if you look on the internet with people who are trying to convince you that FUT is bad surgery, they'll show you some bad scars. Now, most bad scars that exist on the internet are bad surgery. It doesn't make the technique bad. It means the application of the technique was done poorly. But it is also true that even the best of hands, men and women, can have scarring on the back that is less than ideal. It's not 1 to 2 millimeters wide. It might stretch out to 3 or 4 millimeters wide. They usually don't get overgrown and raised, but occasionally they do, and they can be treated as well. So anytime we cut the skin, we're asking the body's healing process to begin doing its job. And not everybody heals the same way. So yes, a linear scar is what you get from a strip. Right, and it can go from ear to ear, but it can be either 1 millimeter or it can be 2, 3, 4 millimeters. If it gets past 5 millimeters, that means too much tissue has been taken out, and there's been too much tension on the wound edge, and that's made the scar stretch. Once it's past 5 mil, that's bad surgery, right? But you can have something up to 5 mil that is not ideal, that is about healing. So it is a linear scarring as a fear. Now, strangely, it's a bigger fear for men than it is for women. For women, they're not going to shave their heads post-operatively anyway, so they know that as long as we don't put it in a visible area for if they want to wear their hair up, they aren't worried at all about a strip scar. But men, because they want to retain flexibility of styling, and they say to me, well, what happens if I lose more hair and I just want to give up, so I want to shave my head? If I shave my head, there's going to be a linear scar on the back of the head. And that's when I say to them, well, the thing to consider here is surgery has its advantages and its disadvantages, and you better be clear about what you're letting yourself in for, because if you do a hair transplant, you are going to have consequences, which is scarring on the back of the head and grafts on the top of the head. If you give up on the process in 5 or 10 years' time, because the baldness has expanded away from your grafts, and you shave your head, that's still going to look weird. And if you shave your head, you're going to have scarring on the back of the head. So you want to be pretty committed to the idea
Sure.
that you want to keep hair on your head if you're going to go down the surgical path. It's not some magical treatment. When patients come in and say, look, it's permanent, I only want to do it once in my lifetime, I want to do surgery. Well, we have to dispel those myths, right? There's no such thing as people who are necessarily going to have one surgery and never lose any more hair and be able to do all of the flexibility of styling they like. It's a little bit more complicated than that. So yes, it creates a linear scar. For most people, it's not a problem, and most men don't care. But ironically, the people that who care the most are the patients who probably should have strip, which is your young, extensively balding man. That's the guy we want to offer strip to give him safe grafts that will grow from the safe donor area. Yet his concern is he's going to have a scar.
That's right. And so, like Russell was saying, a lot of the propaganda, a lot of the information, I should say, on the internet. I mean, most people that we see, that we operate, that have great scars, never go on the internet and take a picture of their scar and go, hey, look how fantastic. It's only people that have had bad scars that will go, oh look, this is the problem. And generally, like you said, it's from over harvesting. But the point that I probably want to sort of veer towards now is that we all recognize that when we're doing strip surgery, that is, you are going to be left with a scar. And we counsel our patients on that and saying, look, if you want to wear a shaved head look, then you're probably going to see the scar. But even if you're not, if you're prepared to have longer hair, you've got to accept the scar. But even if there is a slight problem with the scar, we do have backup options of how we can manage that. So there are a few ways that we can do it. And we'll probably go through this at a later podcast, but just quickly, we can always cut the scar out, resuture it. We can put little dot-like tattoo, scalp micropigmentation into the scar to give that, to break up that illusion of hair, no hair in the scar, and then hair. And then also the other option is to actually do an FUE procedure if you want, and put a few grafts into the scar, because scars take up grafts really well.
That's right.
And so there's a lot of options there to mitigate the downside, which really the only downside of strip surgery, is the scar.
Well, the other one that people talk about, and number 2 over on this side, would be pain.
Right.
So the other argument is that strip surgery is a lot more painful than FUE surgery. And the irony of this is the recovery, yes. The irony of this is that we have patients, both of us, that have had both these techniques done because we offer both these techniques. And there is no universal answer as to who gets the most pain doing what. We've got patients who had FUE and strip who said FUE is more painful. We've had patients that had strip and FUE that said strip was more painful. So one of the things about strip that might make the surgery more painful is the very large harvest, taking a lot of tissue out and putting tension on the wound edge. That tension on the wound edge, the tightening of the scalp from a very large harvest, can be what is a pain discriminating factor and causing people discomfort. So I always say to people, if you're going to take, the patients always ask us, how long is the scar going to be? And we always say that's not the relevant question. The relevant question is how wide is the scar going to be? Because if we have to take out a large number of grafts, it's in the patient's interest, both for the way the scar is likely to heal and from a pain perspective, to take a longer, narrower strip and have no tension on the wound edge, rather than take a smaller strip with a greater width in it, which is going to put more tension on the wound edge. So take-home message for you from here is that the length of the scar, how short it is not relevant. We want to take no tension. We want to create no tension on the wound edge. So we would prefer a longer, narrower scar rather than a shorter, fatter scar. So, and that feeds right into the pain and recovery process, okay? So if you've got people with poor healing of donor scars, that is invariably from taking too much tissue and putting too much wound tension on it. So these problems can be avoided with good design and good execution of strip surgery. So this pretty much takes you through what most people worry about when they look on the internet. So yes, there are pluses, and of course everything has minuses. So this is the introduction to our explanation of how we talk to our patients about what the benefits versus the costs are of doing strip surgery. And now in our next video cast, we'll talk about
FUE.
The pros and cons of FUE. I hope you've enjoyed today's video cast. It's goodbye from me.
Thanks very much, and see you next time.